Hi, I'm Kareem Salhiyyah, consultant cardiac surgeon. Today we're going to talk about aortic regurgitation. The aortic valve is the valve that separates the main chamber of the heart, the left ventricle, from the main artery of the body, the aorta. When the heart contracts, it pumps blood through the aortic valve to the aorta and to the rest of the body. And when it relaxes, the aortic valve prevents blood from leaking back into the heart again in the other direction. The valve is made of 3 leaflets or cusps. They are in the shape of a triangle, similar to a Mercedes sign. In some occasions, 2 of these leaflets join together and forms what's called a bicuspid aortic valve, and we've spoken about this valve in another video. The problems that can occur to the valve, like any other valve, is either narrowing of the valve or leakage or regurgitation, where blood goes to other direction, and in some occasions both occur at the same time. Aortic regurgitation occurs when the leaflets or the cusps fail to meet in the middle and create a seal to prevent blood from going backwards into the heart. What are the symptoms of aortic regurgitation? In most of the patients, they do not have any symptoms. And when symptoms start to appear, usually the disease would have reached an advanced stage. At that point, patient could feel tiredness and exhaustion whenever they do any effort, and they start to feel shortness of breath on exertion. They can experience some chest pains, and when the disease progresses further, they could have irregular heartbeat, and they could have difficulty in sleeping due to heart failure and congestion of fluid on the lungs. What are the reasons for aortic regurgitation? The commonest reason for that is weakness and dilatation of the aortic valve tissues. In bicuspid aortic valve, it's usually associated with aortic regurgitation. The calcification and narrowing of the valve can also result in aortic regurgitation. It is also associated with some diseases of the tissues, such as Marfan syndrome and another one called Ehlers-Danlos syndrome. These are less common ones. So is rheumatic fever, which is an important cause of aortic regurgitation, but luckily we don't see much of it these days. In some cases of infection of the valve, we also see aortic regurgitation. What is the natural history of aortic regurgitation? Aortic regurgitation is a slow disease. It progresses over many years, and the majority of the patient remains asymptomatic until later in the disease when they start to get symptoms. What happens is that the heart gradually dilates or increases in size to allow for more blood, and the heart muscle gets thickened, so it allows to pump more blood into the rest of the body. With time, the dilatation and the thickening of the muscle will increase, and the heart will reach a point of exhaustion where it's unable to cope anymore. This is when we call it decompensation, and we start to see significant symptoms. At this stage, aortic regurgitation becomes a serious disease. If it's left untreated, the mortality or the risk on the life from this is about 10 to 20% every year. Therefore, it is important to address it at that stage. In some conditions, aortic regurgitation can happen suddenly or acutely, and when it does, it is usually associated with significant and severe symptoms because the heart did not get a chance to adapt with the leakage of blood that occurred suddenly. In this case, this is usually an urgent and an emergency operation, and it has to be addressed promptly. How do we diagnose aortic regurgitation? Physical examination is still very important in diagnosing aortic regurgitation. It gives us clues about the presence of a problem with the heart through listening to the heart and picking up a murmur sound. The ultimate diagnosis is made through echocardiogram, which now becomes very accurate and effective in the diagnosis, especially with the presence of modern echo machines and our expertise in performing echocardiograms. Traditionally, cardiac catheterization was used in the diagnosis of aortic regurgitation. However, this is not the case anymore because echocardiograms are very advanced. However, cardiac catheterization are needed to check that there is no coronary disease associated with the valve problem, and also if the patient is undergoing surgery anytime soon, we need to make sure that the coronaries are clean. Sometimes we perform what's called a transesophageal echocardiogram, and this is an echo performed through a scope from the back of the heart. This gives us excellent pictures, and it can accurately diagnose the mechanism of the leakage and also the severity. What are the grades of aortic regurgitation? Aortic regurgitation is classified into 3 levels: mild, moderate, or severe. Depends on the amount of blood that leaks back to the heart with every heartbeat. What is the treatment of aortic regurgitation? The only treatment for aortic regurgitation is through replacing the aortic valve through open heart surgery. There is no medical treatment for that. We can only give some medication to help with the symptoms until surgery is done. When do we need to perform aortic valve replacement for aortic regurgitation? Aortic valve replacement for aortic regurgitation should be performed when the patient is experiencing symptoms in the presence of severe aortic regurgitation. It also must be done fairly soon when there are signs of deterioration of the ventricular function and dilatation of the heart. If the patient has got severe aortic regurgitation without the presence of symptoms, then we have to check for the symptoms by performing a stress test. In patients with mild to moderate disease, we first have to check accurately for the severity of the regurgitation, and if it's truly mild to moderate, then they have to be maintained and regular follow-up with repeated echocardiogram every 3 to 6 months, maybe a year, depends on their condition. Aortic valve replacement for aortic regurgitation is a safe and effective operation, especially if this operation is performed before the heart muscle is weakened or it's dilated. The operative risk is less than 1%. Of course, it's always important to remember that operative risk is assessed individually for each particular patient. Can we change the aortic valve using TAVI in aortic regurgitation? In most of the cases with aortic regurgitation, TAVI is not suitable because a TAVI valve requires calcification of the aortic valve in order for the new valve to hook into, and this is usually not present with the cases of aortic regurgitation. But with improvement in technology, we suspect that there will be new valves that can be used in the cases of aortic regurgitation. Finally, it is important to advise patients known to have aortic regurgitation to have regular follow-ups, and once their symptoms become significant, not to delay their surgery in order to improve their short and long-term outcomes. And we wish everybody health and well-being.